Senator Obama, my name is Reverend Katrina Foster. I'm the pastor of Fordham Evangelical Lutheran Church in the Bronx and part of the Northwest Bronx Community and Clergy Coalition. Senator, your health plan includes a mixture of private and public insurers. Medicaid, Medicare, S-CHIP, the state's children's health insurance plan, has proven itself to be cost-effective and effective in providing health insurance to children like Alexiana and others who would otherwise be uninsured. Private insurers have proven themselves to be big-budgeted and not so good on the cost when it comes to insuring people, especially when people are ineligible because of pre-existing conditions, because of poverty, because of lack of COBRA. Senator, would you agree that it would be better for this country and for the health of our people to expand the use of Medicaid, Medicare, and S-CHIP and not to further reward private insurance through our hard-earned tax money?
Well, first of all, I know something about issues like pre-existing conditions. You know, my mother died when she was 53 years old of ovarian cancer. And in those last few months of her life, I remember she wasn't thinking about how to get well. She was reading insurance forms because she had just gotten a new job, and her insurer on this new job was saying, well, maybe this is a pre-existing condition, and we won't have to pay your medical bills. So I know what it's like to see a loved one suffer, not just because they're sick, but because of a broken healthcare system. Now, if I were designing a system from scratch, I would probably move more in the direction of a single-payer plan. But what we have to do right now, because of people like Deirdre and her daughter, is I want to move to make sure that everybody's got coverage as quickly as possible. And I believe that what that means is we expand S-CHIP. It means that we extend eligibility for some of the government programs that we have. We set up a government program, as I've described, that everybody can buy into, and you can't be excluded because of a pre-existing condition. We will negotiate with the drug companies. They will have to provide the cheapest available price on drugs, or else they won't be able to participate in the plan. And we will not completely eliminate the private market because half of the people are still getting insurance from the private marketplace. But we will give them a choice so that if they feel as if they're being price gouged, they are going to have a legitimate alternative that they can access so that every single person has the coverage they deserve.
Thank you very much, Senator, and thank you to our first group of community leaders. Thank you, young lady. Don't wear high heels when you get my job, okay? Second group of community leaders, will you please join Senator Barack Obama on stage? And it'll be the same format, Senator. First story comes from?
My name is Deborah Carr. I'm from Des Moines, Iowa, originally from Waterloo.
I want you to caucus for me. I got to ask anybody from Iowa.
I'm representing Citizens for Community Improvement Diversity Action Committee. My family's story is about a single mother who's worked hard as a successful entrepreneur to secure the first home for her family. Little did she know that purchasing this home, she would be in a predatory adjustable rate mortgage with a soaring interest rate of 11.75%. Currently caring for a severe asthmatic child with chronic hospitalizations, the family has been denied health care benefits because they say she makes too much money, and she's denied Social Security disability benefits. Now, facing foreclosure and no opportunity to refinance because of this soaring astronomical medical debt, the family had to choose between paying the mortgage or the life of the child. Our family chose life for the son. And as a result, no child and no family should have to be left homeless on the street to figure out where they're going to live when a child can't breathe. No hardworking American citizen that's trying to secure and sustain the American dream should be in this position.
Good afternoon, sir. My name is Robin Gormley. I live in Des Moines, Iowa, and I'm a member of Iowa Citizens for Community Improvement. Over the past 30 years, I have seen a widening gap between the rich and the poor. And the story that Deborah tells is part of that reason. I'm 73 years old, and for the last 4 years, I have been working again. Not because I want to, but because I need to make ends meet. There are many families in this country that are having to choose between putting food on the table, paying medical bills, and paying their mortgage. Even older people, people older than I am, are having to go back to work in order to pay the mortgages that have skyrocketing insurance or interest rates. This holiday season, it is reported that the investment bankers who bought up these subprime mortgages will be giving out $38 billion in bonuses. At the same time, millions of families in this country are facing the prospect of foreclosure. We must close the gap between rich and poor. My question to you, Senator Obama, is what will you do? What are your ideas to help us achieve this goal?
Well, it's an excellent question, and I thank you for sharing your story and yours as well. Look, this is one of the reasons I am running for the presidency of the United States of America, because we've lost balance in our economy. We have CEOs making more in 10 minutes than most people here are making in an entire year. And it's not right, and it's not fair, and it's not good for America. It's not good for our economic growth. And part of the reason is because we've got special interests who have been driving the agenda in Washington for too long. And part of my job, because I'm not funded by special interests and lobbyists, they are not going to work in my White House, and they will not drown out the voices of the American people when I'm President of the United States of America. That's why I'm running. That's why I'm in this race. Now, let me tell you specifically what we need to do. Number one, we have to restore fairness in our tax system. So I've already said we are rolling back those tax cuts on the top 1% that Bush gave out, because we need that money to provide health care for people who need it. We are going to give tax relief to people who need it. So what I've already said is I've put forward a proposal, a tax plan that says we're going to close the loopholes to companies that ship jobs overseas or are setting up tax havens in the Cayman Islands. And as a consequence, we're going to be able to provide relief. We will take the first $15,000 worth of payroll tax that you're paying. We're going to set up an exemption for that. We are going to give homeowners who don't currently itemize on their tax forms, typically lower income homeowners, we're going to give them a deduction on their mortgage to help them deal with the foreclosure crisis. And we're going to say to senior citizens who make less than $50,000 a year, you don't have to pay income tax because you've got enough problems paying for higher drugs and higher other costs. That's just one thing
Senator
that we have to do. How much
Obama,
time?
we're out of time. We're out of time.
I got more ideas, but I'm out of time.
Well, you're going to have another additional 2 minutes.